up, you guys? Welcome back to the channel. My name's Geselle, and today I'm taking you to work with me. Yes, it is 8:30 at night, and yes, I'm drinking coffee. We are going to have a graveyard shift from 9 p.m. to 7:30 a.m. Usually I would work 7 p.m. to 7:30 a.m., but because I guess they didn't need me at 7, they told me to come in at 9. I haven't worked for 5 days. Life of a per diem. And you guys know how that goes by now if you watched other videos of mine. So let's head over to work and I'll get you guys updated. See ya. What is up, you guys? We made it to work, and when I first came in there was like 4 or 5 stats. Only one other person was here, so I had to go to the ER immediately and help alleviate those stats. So now that we have caught up, I can catch you guys up with what has been going on. So last Monday, I had scanned a patient that was pretty difficult, and I think I hurt my wrist by doing that patient in the wrong doing wrong ergonomics, not practicing what I preach. And honestly, the reason why I noticed it was because at boot camp on Monday night, I was having so much hand and wrist pain from the workouts that we were doing. A couple days go by, we do boxing on Thursday, and boxing uses, your wrists, your hands, your punching, and I think I injured it further during that time. I actually had an interview on Friday for another outpatient clinic here in the Valley, and they had asked me to scan to show what I can do. And after I finished scanning, my hand was like shaking and in pain. So the last 2 days, I kind of gave my wrist a break. I tried not to use it as much. Hopefully today, I don't put too much pressure on it. If I move it a certain way, my wrist hurts and then my forearm hurts. So it got me thinking, oh my gosh, what am I gonna do if I can't do ultrasound? But that's me overreacting. I wanted to answer a question that someone had previously asked in one of my videos, which was, how do you manage your time when working in a hospital, especially with all the patients that we have, how it's a heavy workload. And so I'm just going to kind of go over that a little bit with you guys today, the typical day at a hospital location. Now, let me tell you the truth here. Every single location is going to be different. Every single location does things in a certain way, but this is just from my experience. Now, I work in a really big hospital. Some places they only have 1 to 2 techs at a time. Here we can have up to 4 or 5 techs at a time. So that's how we can manage our time getting all these exams done. So with all that information, I'm going to take you through this day and also explain to you what we do and how we get things done. So when you walk into a hospital, usually you're going to have a list of inpatients that are already waiting for you to be done. So generally when you walk in, you're going to see that list of patients. You're going to see who needs to be done first. If a patient was NPO, meaning they didn't have any food after midnight because you need to perform an abdominal exam on them. So a lot of times the abdomen exams are done first thing in the morning. You also need to check who has been rescheduled. Sometimes people are rescheduled for multiple days, so you want to see why they're rescheduled and see if you can get those ones done as soon as possible. There will be some procedures that you're going to have to do. A lot of these procedures have to do with a radiologist, so we're going to also take those procedures, talk to a radiologist, and see when's the appropriate time for them to do those procedures and either bring them down to the department or go up into their room and perform those procedures portably. Now, as you're checking the schedule, you also need to make sure that the ER has somebody that can cover it. A lot of times the ER is random. You never know when you're going to get an ER stat, and those ones need to be done quickly. You kind of just have to manage your time with whoever is there with you to figure out what can be done, in what order, and who's signed up to go where. Now, when I worked at another hospital, there was only 2 techs, so it was really easy to communicate between the 2 of you, who's doing what, who's going where, and how things are going to get done. When it comes to large hospital places, they're going to have maybe a lead tech or a supervisor that's going to assign you guys where to go. So maybe today I'm going to be a procedure tech, say Today I'm going to be the ER person, so I'm going to stay in the ER and get all the ER stats and routines done. Routines are just exams that can be done on their own time. Say I'm going to be a portable tech on this day and I have to go do 7 or 8 patients before lunch. We have multiple towers, so we kind of had a person sign up for multiple patients in that area, so you can be efficient and get to the patients at a reasonable amount of time, finish those exams at a reasonable amount of time, and try to knock out all of the patients that are near each other so it is more efficient, so you're not like running all over the place. That is basically what it's like in the day. If there's 4 techs, each person will be assigned to their different areas. If the ER gets super busy, there's going to be one person who is the ER backup, and they can go and help that ER person out. If there's a stat that's ordered on the floor or tower where you are nearby, the lead tech or supervisor can ask you to go do that exam since you are near that patient. You kind of have to think about what exams you're about to do, how long it might take you to do an exam. It could take about 15 to 30 minutes per patient to get an exam done. Some procedures take 45 minutes to an hour. You have this list of things and you just try to be as organized as you can to get all your patients done as soon as you can, but efficiently and with quality. And you want to make sure that you're treating these patients like how you would want your family members to be treated or yourself to be treated. Working in a hospital can be a lot of stress on your body because you are walking a lot, standing a lot, and pushing your machine a lot. So make sure you work on ergonomics, which is something that I still need to do. Especially if you're working in a hospital, there are going to be patients that can't roll over. There are going to be patients who can't sit up the way you want them to sit up. There are patients that are going to need your help. Just know that you're going to be using your whole entire body if you are working at a hospital. Today when I walked in, there were about 5 routine exams, and so now that we finished all those stats and caught up with the stats, we're going to try to get those routines done and help clean the schedule. We want to provide the best service that we can and get the best pictures for these patients. Let's get some more patients done. On a typical day at work, we could do about 10 to 15 patients in a 10-hour shift. Most of the time, you can do even up to 20 patients in a typical shift. Just depends on the type of exams that you get and how the patients are. So if you have ventilated patients, those can take some time, or if you have a patient that is in a lot of pain, those can take some more time. Sometimes they complain a lot. Other factors that may take a toll on how fast you're going is if the patient needs to go to the bathroom all of a sudden in the middle of your exam, if the patient is complaining because they don't want you to scan them, you might have to go speak with a doctor, let them know what's going on. Another thing that can happen is if other people start to walk in and try to talk to your patient. For example, if you're doing a patient bedside, sometimes a doctor is doing their rounds and comes in out of nowhere and starts to talk to your patient. There are a lot of different factors that can weigh in on how long an exam will take you, but do your best as a technologist to get the best images possible and to get good quality imaging for these patients. That is your job. Take care of these patients well and get good images. Finished 2 different abdomens, one on a pediatric patient and one on an adult patient, both of which who asked me questions about ultrasound. And just like how I explained to you guys, I was explaining to them about how ultrasound works, and I just love talking about ultrasound. Like, it was really cool to see them light up and be excited about something while they're in a hospital and unfortunately do not want to be here. My last patient told me, thank you for explaining ultrasound to me, makes me feel a little bit better. And it makes me feel good to make a patient feel better, and for her to say that to me meant a lot. So the next time you guys get an ultrasound, be nice to your techs, because we see a lot of things and we go through a lot of things, and just little things like that, just a small comment can really make our day. Yeah, that's just being kind to one another. Both of these patients had a full abdomen complete ultrasound. The pediatric ultrasound is a little bit different. All we do is check their bladder before and after. But yeah, both of them took about 10 to 15 minutes to get in there, start the exam, ask the questions, finish the exam, and leave. The workload at night is definitely way different than the workload during the day. During the day, I could do about 8 to 10 patients before I go to lunch, come back after lunch, and still do 5 more patients. It kind of depends. Sometimes you're going to take a long time with one patient, and sometimes Sometimes you're gonna go really quick with another patient. Some people are easy scans, some people are difficult scans. Some people are in a lot of pain and you have to try your best to, let them calm down. Sometimes patients need some medication. So the hospital is like this continuous, every patient is different, every patient has different needs, and every exam is going to take a different amount of time. If you work in an outpatient place, most of the time the patients will walk in and walk out. Their moods also are different than people that are in the hospital. They have a scheduled appointment to go to these outpatient places, and sometimes they just add them in randomly. So the hospital and the outpatient places are two totally different workflows. In your labs and clinicals, you will learn how to scan and how to scan quickly, efficiently, but also with quality. So now that we are caught up with all of the stats, I'm gonna go ahead and do some more routines. I have to also have lunch soon. I'm getting hungry. As the graveyard tech, it is your job to make sure that the schedule is ready for the day shift. What I do is just check the schedule, make sure that every patient that's in the system is on the schedule and ready to go for the morning. I will check the room numbers, check the patients, check the exams, make sure I write down if there's a prior to the exam. If there's a procedure, make sure that information is all filled out. Make sure the procedure is all ready to go and the nurse is spoken to, and we try to get everything organized. We check to see which patients are considered a rescheduled patient. Depending on if they're ordered a certain time is when we decide if they are rescheduled or not, and we pretty much make sure that the schedule is ready so that day shift can come in and know what they need to get done and which things are needed to be done as soon as possible. That's it, you guys. I have ended the day with a couple of pregnant women. Did a first trimester and a third trimester person. The day goes by so quickly, and in the hospital so much is happening that everything's just as a blur. I prepared the schedule for tomorrow, got the procedures prepared, spoke with the nurses, scanned patients, put in the reports, talked to doctors, helped patients out, had lunch. So yeah, just another typical day as an ultrasound tech inside of a hospital on a graveyard shift. We're about to clock out here in a second. I'm gonna log in here, see what the doctor said for some of my exams, because I like to go back and see what they say, see if what I said was correct. You learn from things that you've done, and you've learned from doctors, the way they describe stuff. Looking back at your results are pretty cool. So I'm gonna finish up my shift here. I'll keep you guys updated with that job that I had an interview with, and we will go from there. I wanna thank you guys so much for watching my videos, for liking my videos, and subscribing to the channel. I'm so happy you guys are a part of the family. Please don't be a stranger. You can go ahead and add me on Instagram right here. And I just want to shout out Cassandra, Lily, and Angel for being the winners to my 500 subscriber giveaway. You guys are so great. I hope you guys enjoy your Mike Fit nutrition performance gear and things that you get from their company. Don't forget that you guys can also make an account with them and get $10 for free for just signing up with an email. With all of that being said, gonna eat my snack in a little bit and head home and go to bed because I have boot camp tonight. Boot camp. It was nice talking to you guys. Hopefully you got a little gist of what workload is like in a hospital. And if you have any questions, don't forget to comment below. Be kind to one another, stay positive, and we'll see you guys on the next one. Bye!